morning, everyone. Good afternoon now, I guess. A few minutes late. Thanks for being here. We're really looking at the end of session and what it's going to take to find compromise and balance the budget and get out of session on time, and I'm still confident we can do that. It seems in the last, 24 hours, we took a step back. We believe we're having good discussions on balancing the state budget. DFLers have been willing to compromise. We have taken some things off of the table. We have moved towards the governor, as you all know, at least 85% of the way towards what he wanted for his solution. And we're looking for a good deal for Minnesotans now in the last few days of session. And we always thought that it was important that we looked at this early MA option as something that would be a good deal for Minnesotans. If I could illustrate it for you very clearly. If we put up $1, we get $7 back of our tax dollars from Washington. It is that simple. Minnesotans, whether they're Democrats, Republicans, or Independents, have always been concerned, and currently we're ranked 46th in the nation for tax dollars that we receive back, that we send to Washington, that we get back. For every dollar we send to Washington, we get 72 cents back. That's been a concern of Governor Plenty. That's been a concern of the legislature and Minnesotans in general. This early MA option would bring more money back to Minnesota that we send out there. What do we look? And I just want to throw out a few more numbers here. What we're looking at: 22,000 jobs are on the line with this. $1.4 billion coming to Minnesota from Washington, and coverage for tens of thousands of Minnesotans. We always thought this was a good compromise as well because Republicans have been for this in the past. Last year, Representative Gottwald offered an amendment basically taking folks from the state program and having the federal government cover it. That's in essence what this MA option is. He said it would be a pretty easy fix. Representative Zellers on NPR just this January basically said the same thing, that this was an easy solution that the Republicans brought forward to take this population and move them over to the federal program. And that's what this is. I think we are now at the point where it's more about politics than it is about policy. Because the policy remains the same. After federal health care reform passed, Minnesota was put into a position where they could do this move, and it's going to help our hospitals, our doctors, and it's going to start to bend the cost curve for Minnesotans with health insurance. So the policy hasn't changed, but it seems like the politics at the Capitol have changed. Some of my Republican colleagues who have supported this last year, and even earlier this year with Representative Zellers on NPR, have now stated that they don't want to do this. And that baffles me to some respect, that politics has changed, even when the policies remain the same. This makes great fiscal sense, because as I said before, I mean, this is the easy way of looking at it. But the real numbers are $188 million we put up. We get $1.4 billion of our own tax dollars back from Washington. So that ratio is for every $1 we put up, we get $7 of our tax dollars back to Minnesota. And that's a good deal. And that money goes right to our hospitals. And whether you look at the GAMC fix that the governor really fenced out rural Minnesota and rural hospitals, that problem will be solved in this bill. I know the governor vetoed this proposal, blamed the surcharges on it. And I think we need to have the surcharges sit off to the side for a moment. We can have that debate on how best to finance this proposal. But when you look at the proposal on its face value, I just don't understand how you can be for it one day and be against almost the identical proposal the next day. And so I'll turn it over to Chair Huntley and Chair Thiessen to deliver some more comments as well.
Well, I will be brief. The money, the $1.4 billion that we would get from the feds for $188 million of our money doesn't go to poor people. It goes to our hospitals, it goes to our doctors, it goes to our nurses. Hennepin County is already, hospital's already laid off 200 people because of the cuts associated with the GAMC bill. Shifting